Baylor University Medical Center in Dallas has been flooded with more than 400 inquiries since doctors delivered the first U.S. baby from a uterine transplant. Now, Israel says this procedure could be possible there within 2 years, but not without controversy.
And in Sweden, where the first successful transplant births happened, researchers have laid out how men could also carry babies. Here to discuss the process and some of the problems of this medical breakthrough, Nurse Alice. She's an emergency RN and clinical nurse specialist. Good morning.
Good morning.
So what conditions make women candidates for a uterine transplant?
Well, this is very much still in a study phase. So the candidates for this are women who are born without a uterus, so about 5% of women, or those who maybe have lost during traumatic accidents or maybe from chronic conditions such as cancer.
And what are the prerequisites to have the procedure?
So prerequisites would include someone who's of healthy age. So in this study, they're looking at women in their 20s and 30s who have otherwise healthy ovaries, and so they're able to harvest eggs and get them fertilized during an IVF process. And so these are typically women who kind of have a clean bill of health that should be participating in this.
And so how is the actual transplant performed?
Well, it's interesting. So in different countries, they've looked at donors such as a family member, a sister or a mother, but in some cases you can get the uterus from a deceased donor. So there's a tissue and blood matching that needs to occur, and once that's been identified, the procedure happens pretty quickly, and there's a pretty massive surgery that needs to happen in order to implant the uterus into these women.
Could the donor uterus already have born children?
Yes. Yes. So as long as the uterus is in a typical healthy state, there's no chronic conditions or cancer or anything like that, the uterus should be capable and eligible for a uterine transplant.
And with any sort of organ transplantation, there's the chance of rejection. Is that the same with the uterus?
Absolutely. Just like with your heart and your kidneys, people who have organ transplants need to take anti-rejection medications to prevent the body from rejecting the organ. So these women who are having these uterine transplants do need to take anti-rejection medications, which can have lots of terrible side effects. But, you know, in order to have a baby, it's something that they need to do to make sure that the body doesn't reject it. And then once the woman has taken the medication for about six months to up to a year, and the body's not rejecting the organ, is when then they begin to consider implanting the embryo for the baby to develop.
What are the costs of something like this?
So the transplant itself, just the uterine transplant itself, is roughly about $100,000. Now that doesn't include the harvesting of your eggs, getting them fertilized, and having them implanted once you have a uterus in place. So roughly the whole procedure from top to bottom could cost anywhere up to $250,000.
Wow.
And then so the big question is, okay, is there some way to put a uterus into a man and have the man deliver a baby?
So theoretically, yes. However, this would be a very, very extensive procedure because of looking at gender reassignment and the physical structure of a man. They're just not built to carry babies, right? Let alone the pain tolerance, but we won't get there. Sure. And then also hormonal. Hormones. There are hormones that people who have reassignment surgeries, they take hormones to adjust their features and things like that. But to have a baby, literally day in and day out, 24 hours around the clock, a woman's hormones are changing to adapt and help assist a growing baby. And so that's something that would be so rigorous and almost seem impossible. It's doable, but a lot of time and energy and costs to do something like that.
Wow. I'll let Sam go first.
Oh, yeah, well, please, thank you. All right.
It's a fascinating topic. For more information about clinical nurse specialist Alice Benjamin, you can follow her on social media and check out her website, AskNurseAlice.com. Thanks so much.
Thank you.